Hi, my name is Nicole. I'm a speech pathologist with Louisiana and Voice Swallow Solutions. Today I'm going to show you how to do a FEES exam. That stands for Fiberoptic Endoscopic Evaluation of Swallowing. So whenever we do that, we have a camera that's very small and we put it into someone's nose to look at the anatomy, and then we watch how they swallow. So today we're going to try 3 different consistencies. We're going to try a thin, pureed, and regular consistency. And today we have a patient named Sean, and he's going to be the one that we're going to do the assessment on. So here we go. Hi Sean, how are you doing this morning?
Great.
Good. So what we're going to do is we're going to do a FEES exam. So whenever we do this, I'm going to take a small camera and we're going to just stick it up your nose, and we're going to actually assess the anatomy. And then after that, I'm going to watch how you eat and drink a few things, and then we're going to be done, and I'm going to take it on out, okay? Okay, here we go. So the first thing I'm going to do is I'm going to just look to make sure that there's a good opening. Okay, so we're going to go into the nasal passage. Whenever you're going into the nasal passage, you're trying to find the widest portion that you can. That's going to make it the most comfortable for the person and easier to get through with the camera. We're going to go into the throat, and we're going to start looking at the anatomy. So all the way at the bottom, you're actually able to see the epiglottis, which looks like a little tongue sort of sticking in the upright position, and then right behind that you have the vocal cords. So there is a little bit of edema here, and the reason that they have that is actually because there's a possibility that you have reflux, and that can cause the swelling and the redness. So we're looking at the epiglottis, and you can see the vocal folds moving behind that. The 2 little spots that look like bat wings, those are called the arytenoid cartilages. There is a little bit of saliva with that. Whenever somebody does have excess saliva or excess secretions, you just want them to swallow, and that'll allow you to have a better view of the anatomy. So in doing this test, you can actually see the vocal fold function. So that's going to help with speech and voice, and then also swallowing. So the first thing that we're going to do is we're going to have the person swallow the thin liquids. And we're putting the green food coloring in it, and that just allows us to see the consistencies that we're testing a little bit better than if there weren't any food coloring in it. Whenever the swallow is being completed, you're actually going to have something called a whiteout, and that's where you see the reflection from the epiglottis whenever you're swallowing. So you're not going to see the swallow once it's being completed, but whenever the swallow is completed, you sort of look around and make sure that there's no residue in any of the areas or the landmarks that we're looking at, and that ensures that all of the food and liquid did go into the right place. The reflection on the back where the light is, that's called the posterior pharyngeal wall. The 2 sides are the lateral pharyngeal walls. So again, that's allowing us to look at all of the anatomy. At the bottom of the screen, you can see the base of the tongue. So whenever that's going up and down, we're actually able to see someone chewing. And whenever it hits the base of the tongue, that's normally when the swallow is initiated. So that's the regular consistency, and you can see the completed swallow. There is a little bit of residue following the swallow. In that case, you would have somebody take a liquid rinse, and they would swallow again, and hopefully that would clear all of the residue from the throat. And once this is done and we've tried all of the consistencies, we've looked at the anatomy, then we're just going to come out with the camera and the test would be over. So we just have him doing one more liquid rinse. It's all clear. We're going to come out with a camera and that's it.